Hi, everybody. It's Dr. Eric Balcavage and my partner, Dr. Erica Riggleman,
Hello.
live from Winchester, Virginia. And we are talking today, our second podcast on gut health, kind of an extension of our last podcast. Before we get into that, today's podcast 13, but I want to talk about some cool things that are coming up. I was just coming back from the ShyCon conference in Seattle, Washington. It was a great conference. Dr. Ben Lynch and the team from Seeking Health put on a great seminar. Some great people were there, bright minds. We had a great time. But that also gave me the opportunity to load up a bunch of people to come on the show. So we will have some great guests coming up. We'll have Dr. Brady Wyrick from, where is Brady from? He's from Utah. He's a functional medicine practitioner, functional neurologist, chiropractor. So he's going to come on and talk about what he does in regard to thyroid function and thyroid physiology and his spin with functional neurology. We'll have Dr. Maggie Ruiz Padilla. We will have her coming on sometime, probably like the 19th or the 26th, something like that. And she's a integrative medicine doctor from Florida, so we'll have her come on. We've got the wonderful Dr. Carrie Jones, who is the clinic director or the lab director at Precision Analytics, which does the Dutch test. Super cool woman, really bright woman. She'll come on and talk to us more about adrenal health and hormones. We have the owner of Aerodiagnostics coming on the 23rd. We'll be doing an interview with him, and we'll be talking about SIBO and the SIBO breath test. So we got a lot of people coming up in the next couple months. We'll be doing those and then releasing them as we get time to do them. But we've got quite a few guests coming up in the next couple months. So while I know everybody loves hearing our voices, they can also get some other thoughts on thyroid physiology and what other things kind of relate to what's going on with thyroid health and thyroid function. So
there's so many different aspects when it comes to thyroid and the way that people view it and the way that people approach it. And so this will be a great opportunity to hear other people's approach and to, get their ideas and just, sprinkle that into everything that we're already teaching everybody.
Absolutely. I mean, even from this, the SIBO standpoint, some people may say, why would listening to the director of a SIBO lab have anything to do with thyroid function? And thyroid hormone touches every cell, every tissue in the body. And as we've talked the last time, and we'll talk a little bit about this time on the importance of gut health and gut physiology when it comes to thyroid health and autoimmunity. I mean, you can't really separate those two things. So learning about SIBO, learning about the different types of tests for SIBO, learning why the testing that Aerodiagnostics does is probably the best test right now for evaluating SIBO. All those things are important. Why do you need to know about your adrenals and your hormones? We talked about that on a previous podcast, but everything relates. You got to have good thyroid function to clear your cortisol. You got to have good cortisol physiology to manage and maintain good thyroid function. So everything ties. So every little piece that we can bring is important. So today we're going to talk about the next kind of finish on what we talked about last time, which was gut health and autoimmunity. So what do you think we need to start building on from the last discussion we had?
I mean, we definitely talked about how, constipation and how that can lead to, thyroid issues, but how that can impact other health issues. But the one thing we definitely didn't touch on was, the autoimmunity part of it, because so many people have autoimmunity to their thyroid, and most autoimmunity begins in the digestive tract, and so they play off of each other. And so just hinting at of how autoimmunity can begin in the gut, and then how the autoimmunity can then affect the gut, going back and forth, creating this vicious cycle, diving into explaining leaky gut and food triggers and how that all reacts in the digestive tract, I think is going to be key for, what we're talking about today.
Awesome. Where do you want to start?
Well, why don't we just talk about what how autoimmunity begins in the digestive tract, and how, Hippocrates says that all disease begins in the gut. And I definitely believe that. And I think that it also ends in the gut. So you have to approach it from that aspect that the gut's not healthy. You're never going to be able to get your optimal health back. And so with autoimmunity, the biggest thing is that your cells in your digestive system start to separate, creating that leaky gut. And when things get into the bloodstream, the immune system goes haywire and wants to attack it. And if you already have antibodies to a specific tissue, let's say it's your thyroid, you're then going to create autoimmunity where your body turns on your own thyroid tissue.
So if we talk about gut function, we know that about 70, or it's believed that about 70 to 80% of the immune system surrounds the GI tract, right? So
absolutely,
it is important for the body to have immune integrity, right? You got to have a healthy immune system. Inside the GI tract, there's multiple layers of kind of protection. There's something called the secretory IgA system, and there's a bunch of other layers of mucus and things that protect the cells themselves. We understand part of it, not all of it, but we think we have a pretty good understanding of it. So one of the things that's really important is that we have to have innate immune integrity, right? We have to have a healthy innate immune system. And so that starts from top down, right? So one of the things that helps stimulate and support healthy GI tract function is making sufficient stomach acid, right? To make sufficient stomach acid, we have to have optimal thyroid function. Yep. So you have to have thyroid hormones to make stomach acid. And so those two things are critically important there. If we don't have the appropriate amount of stomach acid being produced because we take proton pump inhibitors, because we got thyroid problems, because we already have a gut infection, because our diet's terrible, because we take high loads of antihistamines, which suppress stomach acid, whether we already have an autoimmune issue, it attacks our parietal cells. There's multiple reasons why we could start the process as a problem in the upper part of the GI tract. And that could be, it could start with thyroid problems and lack of stomach acid. If we lose the appropriate amount of stomach acid, then we don't stimulate the rest of the innate immune system. So bile acid secretions, pancreatic secretions, and those things really help keep the small intestine clean, right? If we don't get good absorption, an appropriate absorption of bile acids, then that is one of the triggers that can lead to leaky gut syndromes, and we'll talk about that in a second. And then we also need to have, along with those bile acids, those pancreatic enzymes broken down so that they can actually break down the food so there's less food for bacteria to ferment, feed on, create inflammation, and create more damage. And then once food moves into the colon, the movement through the colon, the breakdown of food, and the appropriate enzymes, all important there. So definitely step one of preventing a leaky gut or preventing inflammation and autoimmune issues developing is having appropriate acids, stomach acid, bile acids, pancreatic enzymes. Those things are key. What other things do you think people need to know about that are things? Well, let's talk about what leaky gut is. You want to describe what leaky gut is?
Yeah, well, in the digestive system, your cells of the intestinal lining they're tight junctions, so they're butted up really, really tight. And so it only allows small enough molecules to actually go through the junction and get into the bloodstream. So having your body be able to break down a protein, a fat, or a carb, appropriately to the small molecule to be able to get through that channel is important. The problem is that sometimes these channels, they lose the ability to stay closed. And so things wear them down, and then eventually they break open and these channels stay open. And so they're larger, which allows larger things through the channel. And so that could be undigested food, it could be pathogens, it could be all sorts of things that are coming through the digestive tract itself, which normally should not be getting into the bloodstream. And I know you have a great analogy of the screen, if you want to explain the whole screen thing. That is, I think, is great for people who don't really understand leaky gut to understand that those things aren't bad, but when it happens, it can be pretty detrimental when it gets into the bloodstream. If you want to explain the screen door, you're better at that.
Absolutely. So, yeah, I look at the GI tract like a screen in your kitchen window. There's tiny little holes that allow appropriately broken down and digested nutrients to be absorbed through these tiny little openings. If you think about like the screen in your kitchen window, there's little teeny tiny holes that lets the air in but keeps the bugs out. If we have a leaky gut, it's essentially like if I punch some holes in the screen in your kitchen window. Now things that are outside can get inside. And while butterflies and bees and moths and, all kinds of flying stuff may look cute and wonderful outside, inside they create chaos, right? Mm-hmm. We don't like things landing on us, and we don't want a whole bunch of bees and flies and wasps. And inside it just creates a problem. And that's what happens inside the body. We get a whole bunch of undigested proteins that may cross the barrier. We get bacterial lipopolysaccharides. These are kind of toxins from organisms. We can even get the bacteria translocating across the membrane, mm-hmm. which means the bacteria and yeast and fungus gets out of the GI tract and gets into our systemic system, into the body. And all of those things can create immune and inflammatory and eventually autoimmune issues. But it is the integrity of this barrier that's mm-hmm. so important. And what makes it so vulnerable is that there's only one cell layer thick, right? Mm-hmm. So there isn't like a whole bunch of cells there to protect us. It's one cell layer thick. Those cells turn over fairly quickly. But if there's vitamin D deficiencies or there is nutrient deficiencies, those are things that can compromise the integrity of that wall. If there's, like I said, inappropriate bile acid secretion or absorption, that can impact the cell wall. And then a lot of things we do in our daily life can disrupt the integrity of that cell wall, break down that screen.
Yeah, so I think a really big one is the food triggers. And so there are major food components when people eat them. They may not even have sensitivities or allergies to the food, but the food in itself is creating destruction in the digestive tract. And so gluten, dairy, the wheat, those are going to be big food triggers that create leaky gut. And although you may not have autoimmunity to it yet, it's still creating destruction inside that digestive tract, which down the road will lead to more food sensitivities. Because you have to imagine that if you do have leaky gut, undigested food, whether that be, the fats that you're eating or the carbs that you're eating or the proteins that you're eating, if they get into the bloodstream that shouldn't be there, your body is then going to attack it and eventually will develop antibodies to that food. So then the next time you eat that food, you're creating an immune response. And although originally you didn't have autoimmunity to it, it's the leaky gut that leads to more food intolerances. This is how a person can come in and where it may have just originally started with carbohydrate intolerance. Then it leads to, I can't eat meats and I can't eat vegetables and and their diet is down to like 2 or 3 things. This is how it cascades into that.
Yeah. So we get once we have breakdown of the barrier or upregulation of the immune system, we have these undigested proteins that the immune system says, hey, I'm not sure this should be here, and I'm going to react to that. That creates an immune response. And then when you're tying in the autoimmunity, what happens is autoimmunity is when we make antibodies against our own tissue. Mm-hmm. And we know from some of the research that sometimes there's this thing called molecular mimicry, where the immune system is making antibodies to get rid of a protein, but it may mistake our own proteins as the thing that it needs to attack because they look so similar. Mm-hmm. I use the analogy, and it's probably terrible, that if my wife had an identical twin sister and we decided to go out clubbing, which we probably wouldn't do, but if we decided to dress identical and we went out clubbing and we had a bunch of drinks and it was dark and we were pretty hammered, and they both went to the bathroom at the same time. They're both dressed identical, and one of them came out of the bathroom. I don't have my glasses on. It's dark, and I'm drunk, and I give my sister-in-law the kiss because she looks exactly like my wife. Is it really my fault, right? My wife would probably say yes, but what happens is in that we make that really quick mistake, and the body can do the same thing. it's looking to protect itself. So anything that looks like the problem or similar, the body can develop a antibody to that as well. And we see that often with things like gluten intolerance and especially thyroid gland, that some of the proteins in the genetic makeup look so similar that we make antibodies to gluten, and then we also make antibodies to things that look like it, which could be the intestinal lining, things like transglutaminase. It could be thyroid tissue. It could be almost any tissue if the immune system thinks it's close enough to whatever that initial food protein that it's creating a reaction to. So we should talk too about gluten, right? Because that is kind of the sexy thing that everybody's talking about. It's really big that now for people to be gluten-free, and people think that gluten-free, if I'm just gluten-free, I'm going to be good, right?
Yeah, and, it's definitely not the case. And so when getting off gluten is great, getting off the protein, but the problem is that the damage has been done. And so this is where people take gluten-free, they get rid of it in the diet, but they're not going back and fixing the damage that's already been done. So let's say you go on other gluten-free grains like oats or quinoa or buckwheat or tapioca, you're just eventually going to develop autoimmunity to those as well, just because you've got the leaky gut still going on. Those are probably still going to transmit through those channels into the bloodstream and down the road. You're just going to keep continuing whatever you're eating. You're just eventually going to develop autoimmunity to that unless you fix the underlying problem. So this is where a person can go on a gluten-free diet and say, well, I didn't notice a difference. It's because they didn't go back and actually fix the damage that's been done from eating that for 20, 30 years. And that's the key thing, is that there's a process to getting gluten out and then healing the damage so that you don't develop more sensitivities.
So if we kind of fine tune that a little bit, we talk about that screen analogy. If we punch holes in the screen and we've got these big holes, if we think about gluten like flies, and we say, okay, I'm going to stand guard outside the kitchen window, and I'm going to make sure no flies get through the screen. That's like saying, hey, I fixed the problem, right? As long as I kill the flies, there's no problem. And unfortunately, if you just kill the flies and there's still big holes in there, moths are going to get through, mosquitoes are going to get through, bees are going to get through, praying mantis is going to get through. Butterflies, as pretty as they are going to get through, but we don't want all that stuff inside the house. So gluten is a potential problem for many people, but you can't just go gluten-free and assume that you're going to fix the screen, fix that leaky gut, which is what I think you're saying. I'm just trying to give a visual to people, because they think, well, if gluten causes the damage, then if I get rid of gluten, it'll heal and repair. It may, but it also may not. The immune system, once it's upregulated, any protein that you eat with any frequency has a high potential to become a food that you become sensitive to, produce some antibodies to. And so you have to be aware that it's not just about switching from gluten-full grains to gluten-free grains. And I think to tie on that, we have to talk about all some other things that can create damage to that GI lining, because lots of things can do it. And carbohydrates can feed organisms that can break that down. So and a lot of the food, I hate to even call it food, but a lot of the frankenfood that is gluten-free has a lot of chemicals and things in it that are actually more destructive and damaging to the intestinal lining than that wheat-based product was. So it's not as simple as just saying, wow, switch from gluten-full junk food to gluten-free junk food and life will be good. If you still are eating a bunch of chemicals and toxins in your food, it's going to create some damage over time to that GI tract, right?
Yeah, and I don't know if you saw the recent article that just came out that shows that people who go on a gluten-free diet tend to have more health problems or more heart disease, but it's because of the way that they're doing it. They're just switching from one junk food to maybe even potentially worse junk food. And so there's a couple different avenues for going gluten-free. It's just switching from one bad grain to another grain, or you can eliminate carbohydrates altogether, which is going to be, that technically would be a better gluten-free type of diet.
Yeah, eat real food, right?
Yes.
Eat food like it came off the tree, like it walked the ground, came out of the ocean, or out of the ground. However, real food is. You want to eat food as close to real as possible. That'd be helpful. But let's give our listeners some other ideas as to what might be causing leaky gut. What are the things in everyday life that could create leaky gut beyond? We could talk a little bit more about gluten, but what are the other things that can do it?
I mean, it could be pesticides sprayed on your food. It could be stress. So stress hormones, cortisol destroys the digestive lining. Hormonal imbalances have been known, imbalances of testosterone, estrogen, progesterone have been known to cause it. Blood sugar has been known to, the glycosated end products from the breakdown of sugar has been known to break the digestive lining as well. Let's see, just other chemicals that you're exposed to. So whether it's heavy metals or, just other chemicals in our environment have been known to, break that lining itself.
And the medications we take, right?
Yes, absolutely.
I mean, we live in a world where we've been taking medications, a lot of people, for the better part of their life, not realizing that those medications have effects and side effects. And some of the effects of many of those medications is to create B vitamin deficiencies, CoQ10 deficiencies, things that break down or reduce cellular health, things that weaken the gut lining directly or indirectly. But it is a continual problem in our society, where we just blast the system with chronic loads of toxins, and that has an impact on the GI tract, without a doubt. At the ShyCon conference this past weekend, we talked at length about environmental toxins and the load of environmental toxins and the impact that those things can do on our health and on our mitochondrial health, on our tissue health. And there's simple things we can do to improve it. But if you're riding in a car and you got the vents open or your windows open, you're breathing a ton of toxic fumes day in, day out on your drive and on your commute. It is crazy. There's actually a website, it's called Scorecard. I'm not sure if they've updated it lately, but people could actually punch in their zip code and they can find the toxins that are being released in their region or in that zip code. And it's frightening to see all of the potential chemicals that are being released into our air and our environment. And these are things that can make all of us sick, but especially those that are compromised. So we have to think about definitely the stressors in our life: physical, chemical, emotional, the environmental toxins, the water we drink, and all the other stuff we put into the system can all erode that GI lining, creating damage, reducing our enzymatic load, making us much more susceptible to leaky gut, right?
Yeah, and there's one other big cause to leaky gut that's often overlooked with most functional medicine doctors, and it's going to be the brain component or head traumas. So there's studies that have come out in the last couple of years that say if you have a head trauma, even without having a concussion, you can have leaky gut within a matter of 30 minutes just because of the gut-brain axis. You lose the ability for the brain to regulate those cells, and eventually they start to separate. And so there's a lot of connections and studies that have been shown that, when you have those head traumas, that you're going to lead to more health issues because of the integrity of the digestive lining that starts to become affected.
Absolutely. And I'm sure you're seeing it in your patient base, and I'm seeing it in my patient base. You have there's a unique connection between these kids that are having what seem like minimal injuries, and then are wind up with chronic concussion syndromes. And it's a tiny little bing on the head, and all of a sudden they're out for weeks from activities in school because they have concussions. And my thought process on that is that we bombard our kids with lousy diets, unbeknownst to us many times, because we're just following TV advice or doctor's advice of what's supposed to be healthy. We create this damage to the GI lining. We create this chronic inflammatory state. It may not be autoimmune at that point in time, but they just may have chronic inflammation. And as you said, the immune system of the GI tract and the immune system of the brain are tied, right? So if you inflame one, you inflame the other. We've got a bunch of kids running around with already inflamed brains, and it doesn't take much of a ding at that point to trigger the concussion syndromes. 90%, somewhere near 90% of the cells in the brain aren't for thinking, they're immune cells. So they're easily upregulated. And if they're already kind of at threshold or just below threshold, a small little trauma can magnify that inflammation and really create a host of issues. But you also see what you talked about. The person could have really good, pretty good health, pretty good function. They get their car accident, they get their significant ding on the head, and the next thing you know, they've got inflammatory issues or immune or autoimmune issues. And I would say for my middle guy, that's kind of the scenario that happened to him. It was probably a combination of things. We've got genes for gluten intolerance in our gang, but not celiac disease. He had a significant ding on the head, and about 6 months later, he started having migraines. And so we really didn't, that was before I really got heavily into this stuff. But he was good most of the time, but if he got caught, if you forgot about him when he was little and he spent hours watching TV or playing video games, all that high intensity frequency from the TV or the computer would fatigue his already inflamed brain, and it would trigger a migraine. And then, so he had head trauma, inflammation, started having GI issues, eating a bunch of gluten, gets migraines, we did all the traditional testing at that time. Nobody knows what's going on. They just say kids get migraines. But when we do the functional testing, he's got active gluten intolerance, leaky gut, soy sensitivity. I mean, he's got multiple food sensitivities. So there's your link to head trauma creating that leaky gut syndrome, which probably gets ignored quite a bit. And I would venture to say that most of those kids probably have a balance between already inflamed gut and head traumas, and the combination of those two things go together.
Yeah, and what can make it even worse is when the gut-brain axis has been impaired, you lose vagal tone, which also will decrease blood flow going to the intestinal walls. So then it makes it almost nearly impossible to try to heal the leaky gut because you're not getting blood flow there to be able to bring all the nutrients it needs to be able to repair the leaky gut. So it's one of those things that it's a vicious cycle that happens, that if you have impaired gut-brain axis, that it could be very hard to heal a leaky gut, after that, if you're not balancing the vagal tone and balancing the brain-gut connection between the two.
Absolutely. Vagal tone's key to release of neurotransmitters within the bowel. Vagal activity is key to that migrating motor complex. So without vagal activity, you lose innate antimicrobial capacity, you lose migrating motor complex, you lose quite a bit of stuff, and you can really set the stage for chronic infection, chronic inflammation, and an inability to heal. And that probably tailors into one other thing, and I'll let you kind of discuss that, is some people never develop a good immune system, right? And so problems can start off early on in life. So what's that, kind of walk us through that scenario of somebody's start process and why they may not develop a good gut flora and gut biome, and why that might set the stage for leaky gut.
Well, it's the way that they were, whether they were C-section or whether they were the vaginal birth. And so the way that you went through the birthing canal or the way that you had your birth plays a huge role on your health down the road. And so when you have a C-section, or your mother has a C-section when you're born, you don't go through the birth canal, and so you're not inoculated with good bacteria. And so that bacteria going through the birth canal really helps to stimulate the immune system, and abruptly being removed from that environment with a C-section, you often don't get that immune response. And then a lot of women these days aren't even breastfeeding. And so that right there helps to build massive immunity. And so if you're born C-section and then you're not breastfed, your immune system can be very, very dampened. I know from personal experience, I was born C-section and I struggled as a child with health issues. I had an ear infection probably at least every other month. I had tubes put in my ears over 8 times. I mean, I just had so many health issues because, and back then they didn't realize the health aspects of it. My mom had to have a C-section. And so it definitely affects the immune system down the road. And I still struggle with leaky gut, making sure that it stays healed because, of what happened at birth.
Yeah, the research is showing that if somebody doesn't go through the canal, is not inoculated with all the fluid, they don't get colonized with the right types of bacteria. They get colonized with skin bacteria versus what they should get inoculated with. So that sets the stage early on in life. And a couple things you talked about was having chronic infections, right? So if you have the wrong flora colonizing the GI tract, you lose the immune response from having the wrong flora. The right concentrations of flora in the right places is a way to support immune response and one of the ways to prevent autoimmunity. But then when you have infection, what do you get? You get a broad spectrum antibiotic that then wipes out the research I've seen has said about 30% of your healthy flora is wiped out with each round of antibiotics. So that's pretty devastating. So if you didn't develop good flora to begin with, and then you wipe out 30% of good flora you do have, it's not like we wipe it out and that's the good stuff comes right back. Anything can come back. Opportunistic organisms come back, and when we have opportunistic organisms come back and they start to colonize the tissue, they too create inflammation and damage and set the stage for leaky gut issues. And especially those gram-negative bacteria have these toxins called lipopolysaccharides that not only create damage, they're toxic to the tissues, they inhibit a bunch of biological pathways and processes. So what happens with gut flora is critically important to maintain healthy cell walls, healthy cell membranes, help maintain healthy cell junctions, those tight junctions, and prevent leaky gut. And I don't think we can take that aspect for granted. And I'm sure when you're doing a case history and reviewing somebody's files, you look at their timeline and you can kind of see the train wreck coming because see, they had a C-section, they weren't breastfed, they had multiple rounds of antibiotics, they had tubes in their ears, and everybody thinks they fixed the problem because they put a tube in the ear and now they didn't get infection. Well, all you've done is taken some bugs, right, that are anaerobic. Now you've opened up an opening, and now those anaerobic organisms aren't going to grow real well in that environment, but you haven't changed the whole system. You've just changed one small area. So as soon as that closes up, the plug falls out, tube falls out, you can be right back into the same scenario or have other chronic infections and inflammations going on as a result of this just chronic destruction to that GI tract. So it is, you can see that ball rolling. And unfortunately, there's so many people that we're seeing now that are, 30, 40, 50 years old that went through the same experiences we did. C-section, antibiotics, not breastfed, and now they're 30, 40, 50 years old, and they've got chronic health issues, and they're not really fully aware that some of those things that happened very, very early on in life set the stage for their chronic health issues today.
Absolutely. And a lot of my patients, the big thing that they're asking me when we're talking about leaky gut is, well, I don't have digestive symptoms, or, how do I know if I have leaky gut? And so that can be the hard part, is that, there aren't direct pain receptors on the lining of the digestive tract. And so when you have inflammation in your digestive system, you don't always have pain with it. And so, one of the first signs of having leaky gut is brain fog, because, those receptors are communicating with the brain. And so that can mean gut inflammation, and you don't actually get pain with it unless you actually start getting the bloating that pushes on pressure receptors. And so since you don't have the pain, often people think, well, I don't have a problem. And it's kind of, your gut's out of sight, out of mind. You don't see it. But if you had tons of inflammation and your skin was all pussy and inflamed, you would do something about it. People don't see what the inside of their digestive tract looks like, and so they don't realize that the cells could be inflamed or swollen, or little lesions on there. And that in itself makes it for a hard case to really understand or to know if you have, you have to look at all the other symptoms. If you have poor immunity and you have brain fog and you have constipation, those aren't normal. I mean, in our society, we kind of play it off like, oh, you're just getting old, or, oh, that's just, you're blonde. And they just kind of play it off with those things, but your body's trying to tell you something.
Yeah. And I think the other thing is if one person has those symptoms, they're being bombarded on TV that there's a solution for it, right? So, hey, this, stomach acid problems or reflux is normal, just take this. You've got indigestion, you take this. You've got irritable bowel syndrome with constipation, you just take this. It's kind of projected in media like these are all normal things, and the normal solution for that is a medication. So unless somebody's really digging into the science and the research, they're just they're listening to what's not that they're maybe even actively engaged in listening to what's going on, but it is subliminal or subconscious feedback that constantly goes in. And if you then ask your friend, well, I've got this symptom, do you have it? Absolutely. What do you do? Well, I just take something. That is way easier than saying, oh, I'm going to go spend, my hard-earned money, $100, $200, $300 to get a good GI leaky gut test. And then if I get that test done, now I got to have somebody help me fix it. And I got to take things to do it. And I got to change my diet, and I got to change my lifestyle. You know what? The Pepcid is better, right? That's so much easier. And that it does solve sometimes a short-term problem, but the issue is that long-term, 20, 30 years later, they've got chronic health issues. They got autoimmunity, and they're not sure why. It's because of everything that got ignored over the last 10, 15, 20, 30 years. And maybe it's not overt, that they're overtly ignoring those things, but it may just be that they were following the wisdom of the day. And many times what we find is the wisdom of the day is not so good, right?
Yeah.
Anything that promotes chronic inflammation has the potential to promote autoimmunity, and that's the big issue. And so depending on the set of genetics you have, depending on your predispositions, your lifestyle factors, two people can have leaky gut, 10 people could have leaky gut, have increased inflammation, and they can all develop different types of immunity or autoimmunity. And that's what's really kind of the tough part. There is no set or perfect patient when it comes to leaky gut syndrome. Everybody manifests differently. And in traditional medicine, they really like this model of everybody fits a box, right? So everybody's got a thyroid problem gets this. Problem is we never treat what caused this. And so we just treat everybody with that diagnosis. And so that's why people fail. We have to get to root cause. And there could be 10 different reasons why 10 different people develop leaky gut. And we have to fix not just the leaky gut, and not just treat their symptoms, but we actually have to help them understand why they developed in the first place. And if it's something that's still an active issue, we have to help them. We have to help them understand that. If it's you're continuing to eat gluten and you're gluten intolerant, we can give them medications that suppress their acid, their gas, their bloating, that can make them poop when we want them to poop, but it doesn't fix the issue. Can they do glutamine-based support? And maybe that helps the GI tract heal and repair, maybe temporarily, but not if they're constantly doing the same things over and over that cause destruction of the tissue.
Absolutely.
So we probably should talk about testing. How does somebody go about testing whether they have a leaky gut? Do they need to test it? And then if they do have a leaky gut, what are the things that they should consider to try and help heal that leaky gut?
Well, one of the tests that you can run is you can run a Cyrex, leaky gut test for intestinal integrity. Personally, I don't run it on patients because I feel like it's a waste of money, because if you're coming in with health problems, you have leaky gut. So the money can be allocated to better places that we can help support, because the reality is you're going to have leaky gut. We're going to have to work on it anyways. So let's just assume you have it and work on the foundational stuff. Now, later down the road, if once we start supporting you, if we want to test it to see if we still have it, that's usually the indication of where I, throw in that test if I feel like it's necessary.
So Cyrex Labs has a specific leaky gut panel, right? That measures gluten and zonulin and LPS. There's some other labs that are out there, and I think the lab that I really like as of late that's doing some GI testing is the GI map test.
Yep.
And somebody told me they added zonulin or gluten or zonulin to that test. I haven't seen it yet, but and I haven't talked to Tony about that. But if they do, that's great. But there are markers of gut inflammation and some other markers on there that would help you understand things that are going on in the GI tract. And if they add that specific leaky gut marker, that'll make that test even better.
Yeah, I think it's an add-on to the GI map test. Like on the requisition form, you can add it on. I don't know what the price is, but yeah, you can definitely add it on.
Awesome. I'll have to double check that. So definitely you don't have to test it if they've got food sensitivities, food allergies, gas, bloating, pressure. They've got immune issues, autoimmune issues, high blood pressure, skin disorders. If they've got allergies, almost any health problem, they have a leaky gut, correct?
Yep, that's correct.
If they take medications, they drink a lot of alcohol, they don't sleep well,
stressed out,
stressed out, they may have a leaky gut, right?
Or they've ever been on an antibiotic.
They could have a leaky gut, right? So you could do it. I think the person, if they're listening and they're really healthy and they're trying to optimize their health, getting a good GI panel, a leaky gut test may make sense, because you may say, well, I don't think I have it. I'm pretty healthy. I should check it. But for almost anybody else, do you have to have it done in the beginning? You do not have to have it done. You can, a physician like Dr. Erica or myself or another functional medicine practitioner would probably say, you've got all these issues going on, you've got all these symptoms, more than likely the gut barrier is compromised and we're going to start working on it, right?
Yeah.
Now, here's the issue they may have. They go to their primary care physician, right? Or their medical gastroenterologist, and they mention the word leaky gut syndrome. What is going to happen to most of those people?
They're going to get a big eye roll.
And so in traditional medicine, even they consider leaky gut a functional disorder, even if some physicians may not even characterize it as a real disorder yet.
Yep. Yeah.
And the reality is the research has clearly showed that there's this process going on called leaky gut syndrome. But because it's a functional disorder, and in traditional medicine, they don't do functional testing, they do more pathology-based testing, that you're probably going to get the eye roll. You're going to be told there's probably nothing wrong, and that you just have irritable bowel syndrome if you have a bunch of symptoms. They will keep testing for disease and pathology when you eventually have a disease or pathology, an inflammatory disorder of the bowel, where they can see disease and pathology. They will then label that disease, but you more than likely didn't get to that disease without having the leaky gut issue first.
Yep.
Right?
Or another thing is that they'll recommend a colonoscopy, and when it comes back good, they tell them they don't have leaky gut.
Right, which is really a test for pathology, right? Yeah. So again, they can do an endoscopy or they can do a colonoscopy. Those are more looking for diseased tissue, and we're not necessarily talking about, when we're talking about leaky gut, it's not necessarily a diseased tissue, it's a dysfunctional tissue. And there is a difference between the two. Unfortunately, in the two kind of worlds of integrative or functional medicine, we work on a functional model, and in traditional medicine, most of the docs are working on a disease pathology-based model. So there really isn't a problem until it's overtly clear that there's a problem. And a great example of that we hear about all the time is diabetes, right? In our world, as soon as somebody's having low and high blood sugar symptoms, they've got a blood sugar problem, right? In the traditional model, they may say, you don't have a blood sugar problem until your blood glucose is 126 and your hemoglobin A1C is over 6. A person in that model may often not get any attention nor any guidance until they're actually full on diabetic. In our world, we want to catch them very, very early on because we know the destructive effects of poorly regulated blood sugar. We don't want to wait till they're diabetic. It's hard to come back once you become diabetic and have a lot of destruction. The same thing with the gut. If you don't address that leaky gut issue early, you will wind up with some type of immune and autoimmune issue and some inflammatory GI disorder potentially. And once you have destruction of the tissue, sometimes the only outcome is surgery to remove diseased tissue. And that's absolutely not what we want to happen to our patients.
Absolutely.
So if we have a patient who's gets tested or doesn't get tested, and they find out they got leaky gut, what are some general recommendations that we should give them to say, hey, these are some things you have to consider. These are things that you can consider doing on your own. While we both highly advise that they've got a lot of chronic health conditions that they really work with somebody who's trained to help them, what are some of the suggestions that you would give them, maybe support products, dietary stuff to help heal a leaky gut?
Well, you want to get off the big things that can create, digestive distress. So, going on a whole food diet of fruits, vegetables, and meats, getting rid of the sugary foods, getting rid of processed carbohydrates. Even some of the beans and legumes and nuts and seeds tend to be irritating to the digestive lining when you're trying to heal it. So, eating more of a kind of paleo type of diet, maybe that's more geared towards just meats, vegetables, good fats, for a period of time while you're allowing your digestive system to heal. There's some great, amino acids that people can take, glutamine, the aloe vera is a really good one. Marshmallow root is an herb that people can take. There's some really good products for healing, the digestive lining or soothing the digestive lining that can help repair the lining, as you're starting to heal. And then you want to work on, your overall stress load, environmental triggers, everything that we've talked about, that you want to do the opposite of what created the problem in the first place.
So they can, step one, modify their diet, right?
Yep.
You want to eat a real food diet, and keep the carbohydrate level low so that we're not feeding organisms and we have less likelihood of developing immune issues going forward. If there's gas, bloating, pressure, refluxy symptoms, you probably want to consult with a functional medicine practitioner because you want to get the right support, whether it's digestive enzymes, bile acid support, or stomach or HCl support to support stomach acid. Your best bet is to really work with somebody so you understand dosing and which one of those is more appropriate to give. Then they can use a glutamine-based repair powder. There's lots of them on the market that can help the GI tract. And then lastly, one of the things we want to do is we want to make sure that then we start to work on putting good bacteria back into the system in time. How long do you need to heal a leaky gut? Sometimes people say 2 weeks, 30 days, 60 days. The reality is everybody's different. Everybody's an N of one. How do you know that you've actually got the GI tract healed? If your symptoms are improving, there's a good indication that you're probably healing the GI tract, but it doesn't necessarily mean you've actually healed and repaired that leaky gut.
Yeah, I always tell patients to give this analogy is that most cells, they have a turnover rate, and it could be ranging from, months to a couple months, 120 days. And so as you're trying to heal your body, each cell that you produce is going to be healthier. And so it may take, 120 days where that cell turns over and you get another one. And that one's a little bit healthier. And then in another 120 days, another one comes up, and it's every single time that cell turns over, you're getting healthier and healthier. So yeah, it could take quite a bit of time to actually get your digestive system back to health. So sometimes it isn't just as simple as, a 2 or 3 week. You may be moving in the right direction, but if you revert back to all the other stuff that created the problem in the first place, then your cells are going to tank back down and go in the opposite direction.
Absolutely. And the other thing that they have to consider if they're trying to heal leaky gut is you have to have bowel motility. And so if your bowels are not moving, if you're not having a good, healthy 1 to 2 bowel movements per day, you need to see somebody, work with a functional medicine practitioner to get the bowels moving, because it'll be near impossible to heal a leaky gut if you don't poop every day. If you think, and I just talked to somebody the other day and they say, hey, I poop normally. And the one person said it's like, and they said, every couple days I go regularly, and that's not good. And the other person said, well, I go every day, but I just use Metamucil to make it happen. Well, if you have to take something to force your bowels to move every day, that's also a problem. And you really, in that situation, you really need to work with a functional medicine practitioner. So to wrap this up, one of the big things that leads to immune and autoimmune issues is damage to the GI tract. And leaky gut syndrome is one of the big things that's kind of being talked about quite a bit. The foods, the environment, the toxins, the bacteria, lots of stuff can erode that GI lining. It probably needs more attention than most people give it. If you've got any type of chronic health issues, allergies, thyroid problems, you're taking medications, you're drinking a lot of alcohol, those are all things that will disrupt that barrier. And you probably need to work with somebody to start to heal that. If you don't want to work on it with a practitioner, at least in the beginning, you definitely want to focus on an anti-inflammatory diet. And there's lots of those. You can Google and see those. But it is a blend of paleo and vegetarian, and you kind of laid that out very nicely before. There's lots of options out there if you Google anti-inflammatory or autoimmune diet. It is restrictive in the beginning till you get used to it. Once you get used to an anti-inflammatory diet, a lot of people find it's really easy to follow, and they can pretty much do that on their own. They don't need to, they don't really need to add a lot of stuff back. And I recommend that it's close to that diet as you can live 85% of the time. That's probably a good thing. There's glutamine-based support powders. There's probiotics. All those things can be helpful. But I think if you've got chronic health issues, chronic immune and autoimmune issues, your best bet is to really find a functional medicine practitioner to work with, so you wind up doing this right the first time, and you don't wind up like I see a lot of patients. Well, I just went gluten-free and put all the gluten-free grains in. Now I can't eat anything, and I got chronic gas and bloating, and they're probably worse off. If they would have just sought somebody out in the beginning, they probably would have been a lot better off, and they would have probably spent less time in agony trying to figure out what's wrong with them. So let's wrap this baby up. We'll be having a bunch of guests on in the coming weeks and months, so we're excited about that. Some great podcasts coming up. If you are looking for help with your chronic thyroid issues, thyroid symptoms, thyroid condition, or any kind of chronic immune or autoimmune condition, you can always reach out to Dr. Erica and myself. You can find Dr. Erica at
on Facebook. You can find us at Brain and Body Health Center, and then our website is brainandbodyhealthcenter.com, and you can find us on Instagram at Doctors Riggleman. Awesome.
And you can find me at chronicconditionrecoverycenter.com. I have a thyroid-specific site, thyroidproblemsdoctor.com. And you can also find me on YouTube and I don't know, wherever, doing my Thyroid Thursday videos. And so if you have any questions or need any help, obviously reach out to Dr. Erica and myself, and we will do whatever we can to help you out. Until next podcast, it's always great working with you on the podcast, Dr. Erica. Have a great weekend. It's beautiful and rainy here.
Yes,
hopefully
here too.
It's there.
Yeah.
And everybody else, if you have questions, reach out to us. If you can go to iTunes and put some reviews and comments there, that would be awesome. And anywhere you watch this video, if you have questions, just put the questions below wherever you watch the video, and Dr. Erica and I will get those questions, and they can be things that we answer immediately to you or things that we talk about on a future podcast. So we'll sign off.
Yeah.
Good?
Yeah. We'll see you next time.
All right. Great. Have a great weekend.
You too.